morning everyone. So today I'll be presenting our paper on the clinical differentiation of Pythium keratitis via a photographic survey. So Pythium insidiosum, as we know, is a parafungus that causes keratitis, which is very similar to fungal keratitis, yet it is difficult to distinguish it clinically, microbiologically as well as histopathologically from fungal keratitis. This one has a very slow growth rate in culture, thus requiring DNA sequencing for the accurate diagnosis, which may not be feasible in all laboratories. Pythium is also recalcitrant to antifungal therapy because it lacks ergosterol in its cytoplasmic membrane. The clinical picture is almost similar to fungal keratitis with very few distinguishing features. Pythium keratitis progresses very rapidly and responds poorly to treatment. Most cases need keratoplasty or evisceration if not treated appropriately. Despite this critical role, it is unclear how accurate is clinicians in predicting the causative organism based solely on the clinical appearance. And it is also unclear which clinical sign can be used for this determination and whether the signs are actually predictive of the etiology or not. So we included clinical photographs of culture-proven cases of Pythium keratitis and fungal keratitis. All ulcers were moderate to near total in size. All photographs taken with uniform resolution and magnification with the same camera. We excluded perforated ulcers, small ulcers, all cases of mixed infections. So from our EMR database, we selected 30 slit lamp pictures, out of which 13 were of Pythium and rest were fungus. And then we conducted a photographic survey with the help of Google Forms platform, and the specific link was sent to the participants to respond. The graders have to first diagnose whether this picture is that of Pythium or not, followed by selecting the most appropriate clinical features which help them in making this diagnosis. So our primary outcome was to evaluate the knowledge and skills of the clinician in diagnosing Pythium keratitis from fungal keratitis based on the clinical appearance. And the secondary outcome was to assess the predictive accuracy of these clinical signs in differentiating such cases. So we computed the categorical signs with use of Fisher-Rectas test and continuous variables with the help of t-test. So a total of 42 cornea specialists actually participated in our survey, out of which 28 were cornea consultants and 14 were fellows. Among the 28 consultants, 7 had less than 5 years experience, whereas more than 11 had greater than 10 years experience in this field. The sensitivity of differentiating Pythium keratitis from fungal keratitis was nearly 55.86%, specificity was 64.43%, positive predictive value was 55.68 and negative 66.24%. The specific clinical features which were enlisted by most of the participants were the presence of tentacles, peripheral guttering, dot-like infiltrates and elevated epithelial plaques. The clinical sign which was most commonly quoted by the participant were tentacles and peripheral guttering. The fellows were able to identify most of the dot-like infiltrates which helped them in diagnosing, whereas the cornea consultants used more of peripheral guttering and tentacles for the differentiation. However, there was no statistically significant difference in the differentiating ability between a consultants and the fellows group. Analysis also showed that the years of experience had a significant association with the identification of clinical features. So as we know, the prevalence of Pythium is around 5.5 to 3.9% in India, but this one has a high evisceration rate which ranges from 53.3 to 91%. Despite this wide geographical distribution, Pythium keratitis is still highly underdiagnosed and underreported. Although the clinicians who participated in our study were all cornea specialists with years of experience, nearly half of them had come across less than 5 cases. And 3 of the consultants with more than 10 years of experience as cornea consultants have never diagnosed even a single case in their entire career. There are similar studies by Dalman et al. And Dalgreen et al. Using similar photographic survey, but this was to differentiate between mycotic keratitis and bacterial keratitis, and they had good results. Pythium, we know, responds very poorly to medical treatment. However, a favorable response is now seen to a triple combination of topical linezolid and topical and oral azithromycin. Pythium antigen immunotherapy is an emerging novel treatment, but the efficacy remains controversial. Currently, therapeutic PK remains the most effective treatment, but it has to be done as early as possible. Nonetheless, recurrence and graft failure is very high. So to conclude, Pythium keratitis is a mimicker of fungal keratitis but with a different line of treatment. The specific clinical feature which help us in differentiating includes deep peripheral guttering and the presence of tentacles. Clinicians in our study were able to differentiate Pythium accurately by only 55%, which shows that the knowledge is still lacking among the clinicians. Therefore, there is need for further studies to pick up the early diagnostic features and easily accessible microbiological test, and it is very important to increase the awareness about this emerging etiological agent among all the clinicians. Thank you for your patient listening.
Your comment that the clinicians were, not competent enough is not correct actually, because otherwise we won't need microbiology in corneal ulcers. The top expert will probably diagnose just by looking. So that we all know is not possible. That is why we do microbiology. So don't make a comment that the clinicians were not good enough or things like that. I mean, I don't think that's reliable. Otherwise we won't need a microbiologist.
The things which doesn't come in your mind, you cannot write it. And second, what serological test do you conduct? Any serological test you conduct?
Serological test?
Yes.
Actually, the DNA assessing is actually the best accurate method to diagnose it. All other tests doesn't have that.
You are doing it there?